Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So giving voice to people with speech, language, and swallowing disorders is a pretty big order. A lot of people, you'll notice, as one ages, even if they're healthy, the first thing that seems to go is their voice. They don't speak loudly enough. They have choking. There's all sorts of things that happen, and unfortunately, water doesn't make the difference. In fact, it makes it worse. So I'm so glad that we have a real expert. Keith Kolesar is a speech-language pathologist over there at Regents Park of Boca Raton, and boy, have I wanted to have you on the radio show, Keith.
Well, thank you for having me.
Well, it's a very important profession, I must tell you, and you probably see people come in there one way, and after you've done your therapy, they leave a different way.
That is correct, and that's what makes it all worthwhile.
So tell us how you got involved in this kind of a profession. What did you like about being a speech pathologist, and just tell us about it.
Sure. What got me interested in the field was actually my brother. My brother is also a speech pathologist, and while I was attending the University of South Carolina working on my bachelor's degree in psychology, he was there finishing up his master's degree in speech pathology, and he was talking to me about what was I going to do in the future. And I said, I could go into clinical counseling, I could get my master's in psychology. And he's like, you know what, why don't you come with me one day and see what I do? And sure enough, I went with him one day, and he was working with patients, and I really didn't know a lot about speech therapy at the time, but it looked like something I really wanted to get to know better and to really look into. So that's kind of what really got me started. And at that point, I finished my my bachelor's degree with the University of South Carolina, and then I pursued my my master's degree in speech pathology at Nova Southeastern University down here in Fort Lauderdale. So that's how I got started.
Well, that sounds good to me. And so is your brother happy that he now has his brother in the same profession?
Yeah, he was surprised, but it's interesting that he is totally taken another route. He's still a speech pathologist, but he specializes in pediatric feeding disorders in Brooklyn. So he has his own little business, and it's called the Brooklyn Feeding Academy. And he's taken it a whole other route where you really wouldn't even think about it. But and I'm more of a traditional speech pathologist in what I'm doing.
Okay, well, and I do understand what you just said about your brother, because actually, even though speech pathology is talking, if someone can't get their speech correct, they probably aren't going to swallow very well.
Well, there's a lot, and a lot of people don't realize that. With speech therapy, we also work with a lot of swallowing disorders, and even here at Regents Park, it's probably 80 to 90% of what I do is helping people regain their swallowing.
That's very interesting because, unfortunately, people want to eat the way they've always eaten. And if they can't, they choke. It goes down the wrong way. They stop eating. They think if they just put some liquid in, it's going to help. And, of course, as you know, and you know better than any of us, it's not good because now it's going down the wrong way and it's causing even more severe problems.
That's correct. And they term that an aspiration. When something you eat or drink is going into your lungs, and it can cause an aspiration pneumonia. So it's very critical that, that we get that treated, and so we can get people back to health. And a lot of people don't realize, that's part of the problem. What's going on with them is that, anything can happen to you in the hospital. It doesn't have to be a stroke. It doesn't have to be Parkinson's disease. It can just be weakness, and then something's going on with their swallowing. Their muscles get weak for the swallowing also, and that's when they start developing problems. And then that's when the speech therapist is called in, and we can do an evaluation and, try different textures, different liquids, thickening the liquids, those kinds of things to help remediate the swallowing problem. And then that's where I come in and do the exercises for the swallowing and things of that nature.
Well, I just want everyone to know that this is a very important conversation that I'm having with Keith Kolesar, and he is the speech language pathologist over there at that wonderful, famous Regents Park of Boca Raton, which is such a great place. I'm Anita Finley, and you're listening to Boomer Times Radio, and I'm just having a great conversation with Keith about a subject that's very dear to my heart because so many older adults, first of all, their voices are changing to begin with, and it's raspy. I don't know if mucus is part of a discussion that you ever have, but I get the feeling that that's one reason too.
Sure.
But I guess what I really want to do is if you could just kind of go through what a typical evaluation would be. So if someone's listening now and they're having some of these problems, that they hear what's going to happen to them.
Sure. Now, what my evaluation usually starts with is an order from the doctor. They've recognized in the hospital that they've had some issues, some problems. They've reported some problems with their speech, language, or swallowing, or voice. I get the order for the evaluation. I'll do a thorough chart review. I look over all their medical records, look at past medical histories, any information that's in the chart from the hospital, any evaluations that were done there. I'll of course look at and take that into account. And then at that point, I'll go to the patient and I'll set up an evaluation to see them, and I'll do an interview, just talk to them, have them explain to me what's going on, what do they think's happening, and then I will go into detail about what I do and what we're looking for and what I think's going on. Sometimes it's swallowing, so I'll see them at a breakfast meal usually, and I'll see what they're eating, and I'll actually do an evaluation. I'll do an oral motor exam. I'll look at how their tongue, lip, cheek, all that is functioning. I will actually give them things to eat and drink and see how they're doing with their swallowing. I'll palpate their throat, look for elevation of their Adam's apple. I'll use a stethoscope to listen to their swallow. And if I have to make alterations at that point to their diet, I'll either thicken the liquids or I'll thin them out if they don't need thickened liquids. I will change the texture of their diet. Sometimes they'll need to have pureed foods to help it go down easier. Now, that's with the swallowing. Now, if I'm looking for voice, I usually, if they're having a voice disorder or problems with speaking with their volume, or I'll test their voice with a sound level meter to see if they're at the normal level with a sustained ah sound, we call it. We test the levels and make sure it's within the norms. And a lot of times with voice, it's poor breath support usually, and that they're not able to move the air to increase the volume of their voice. So I'll work on breath control exercises for that. And sometimes people come in with slurred speech, so I'll do the oral motor exam. I will do exercises for their articulation. And then with, say, someone coming in with a stroke, sometimes they will have aphasia, meaning that they can't express themselves with words or they're not understanding. And that involves a whole nother set of tests that I will do with them to determine, what their language abilities are, and then I can target those areas and formulate goals for them in the evaluation, and then those are the things that we're going to be working on, during their stay here.
Wow. I'm sitting here so
impressed. It's a lot, yes, it is.
It's fantastic. is this a very old field? I mean, what would have happened 30 years ago?
30 years ago, speech therapy has been around for a long time, but since around 1980s, in the mid 80s or so, they've added on the swallowing. Now that was something that really wasn't recognized back in the day. People got pneumonia, but they didn't understand where it came from. So then they started recognizing that it's an aspiration pneumonia. So at that point, they were looking at all the disciplines of rehab, and they decided to lump speech therapy in with the swallowing. So that's our domain now. So I basically say we're doing a checkup from the neck up. So I handle everything from the neck up.
That's great. Check up from the neck up.
Yep, check up from the neck up is that's how I coined that, and
that's
people kind of understand that. So, but before, speech therapy was just mainly working on articulation and language. Now, of course, we still do all of that in voice, but a lot of it now is, and it's become more medical, is the swallowing, because we handle a lot of people with swallowing disorders.
Well, I'm asking you actually as a personal question, because my husband is 91, and he's always he's made lots of speeches, and he's an author, and he's going to be making more speeches. But I notice that his voice starts to go lower, and then I tell him you have to sit up and make it louder. And I said, I'm going to get you to a speech therapist, because I think they could help you. Now, he's not in the hospital or anything. He lives at home. Do you have to be in the hospital to come, or can it be an outpatient?
Well, we do offer outpatient therapy here at Regents Park, but no, you wouldn't have to be in the hospital for that.
And then his doctor has to write a prescription?
Yep.
He could do that.
He could do that. Now, does he have any underlying problems?
I don't think so. I mean,
like not Parkinson's.
No,
that.
No diseases. No.
Good. It's just weakness, right? So he
Yes.
probably needs a lot of breath support.
Yes.
And probably some articulation type things.
Probably right.
Yeah.
He's made lots of speeches in his life. He's held very big positions, but now I just noticed this is happening to him, and I now he does wear hearing aids, and of course I think that may have a little bit of something to do with it. I'm not sure. Yeah,
it can, and a lot of what I get too around here is spouses say, my husband's voice is getting low. I can't hear them, but in reality, they can't hear him because their hearing's going bad. And they need to, I usually have to refer them to audiology because, they think his voice is going bad, but really her hearing is going bad.
I love that.
Yeah, so I get that a lot too, but it doesn't sound like that's
not the case with us. No, it's not. But it's interesting that we're talking about this now, because I've been doing radio for many, many years, and I'm always sharing his life with everybody, because he's had new knees, new hips, he's done all that. But I'm very excited to talk to you. So I'm going to arrange, and he wants to do this. Actually, he started yesterday trying to do some exercises himself. He was, whoa, 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 whoa. And he was,
oh, yeah? Okay,
I said,
he's doing his own therapy.
No. But I want someone like you, a professional, to really let him know what he should do. He's very smart, and he's very no cognitive problems. So this is perfect, and I will do this. So anyway, now we'll get back to other people.
Sure.
I wanted to ask you, though, when people are there and they're on all sorts of medication, could that change from, let's say they were fine. They go to a hospital, whatever's happened to them, now they come for rehab, whether it's a hip or shoulder, therapy, whatever's happened. Can that change their speaking also?
Yes, it does. In a lot of cases it does. Now, what I see here a lot, with the voice and the changes in voice, is that, say they had a hip surgery or something like that. They've had a surgery. So what happens is they get endotracheostomy, right? They get the tube down their throat during the surgery while they're under anesthesia. And what that happens, what we see a lot, is that sometimes there's some vocal cord trauma when they do that. especially if it's emergent and they had to put that tube down there quickly, they're not really paying attention to the vocal cords. They have to establish an airway. So what happens is there is some vocal cord trauma. So what I get when people come here is that they have a raspy voice, or they have what we call aphonia, meaning no voice, right? So that is something that I work with here too. But medications I've seen affect voice with a drying effect. Like a lot of medications have drying effects. So if the vocal cords are not hydrated very well, you have problems with your voice. So, there's things called vocal hygiene I work with, like taking care of your vocal cords, we say,
Well,
making sure you're hydrated,
right.
No alcohol, no smoking, this kind of thing.
This is very interesting. It's funny, when he has a glass of red wine, my husband, he coughs. He coughs, which must be like acidic.
Yes. Yes, it could be. He might be having a reaction to the wine. I don't know. It could be the acid. It could be the alcohol itself having a drying effect on the vocal cords. So,
Well, he won't like you if you tell him he can't have his glass of red wine.
No. I mean, everything in moderation, we say, right?
He's pretty moderate. But I want to just keep going on this with people who are there. Now, speech pathologists, you talked about strokes. What about, we all know what happens when someone has a stroke. Many times they can't communicate.
Correct.
What do you do to help them through that?
Well, it depends on the severity of the stroke, but a lot of times we have to start with what's there. What do they have, So, like, for instance, right now I'm working with a patient he's lost all of his language. He had a big bleed in his brain and he's having big problems. But what I'm working with him is just starting with just the rudimentary things, like rote language, we call it. Rote language is counting and giving you the days of the week, the months of the year. These are ways to get that language out, because he knows what to say, just can't get it out. We start with doing things like that, and then if it's even worse than that, then I start at the sound level. We got to get the sound before the word, and then the word before the phrase. So, yeah, it's just working in succession like that, and that's kind of how you do it. And there's also a technique called melodic intonation therapy, where with people with expressive aphasia, they can't talk. They're able to get phrases out if they sing it. It's very interesting. Like I can wow people by having their spouse or their father or anybody just sing "Happy Birthday," because most of them can do it. And even if they've not uttered one intelligible word, I can get them to sing "Happy Birthday."
Really?
Yeah, and that works on your primary language center, which this is the old parts of your brain that just these things from day one, from when you're a little kid. And that stuff is still there. We just got to learn how to tap into it. So sometimes I'll use that technique, this singing technique, and they'll be able to communicate simple wants and needs that way.
Oh, I love that.
Yeah, it's an interesting. It's strange how the brain works, but sometimes those techniques actually work.
It must give them so much confidence that now maybe there is hope for them.
Exactly. It just gives them something to grasp on, like maybe I'm not trapped in here.
Oh, wow.
Something to grasp onto.
And one thing I know about Regents Park of Boca is that you work very closely with all the other therapists.
Oh, yes. We have a great group of therapists here, and we all try to work together. And sometimes we co-treat with the other therapists. Just trying to get the maximum amount of progress out of these folks while they're here.
That's a great thing. Well, I just want to tell everybody again, and by the way, the thing you can do, a lot of you, of course, who listen, read Boomer Times, and if you go to page 14, you can see the attractive Keith there at the bottom of the article that he wrote called Giving Voice to People with Speech, Language, or Swallowing Disorders. And Keith works there. He is a speech-language pathologist there. So if you're thinking about as I'm going to do as an outpatient, you can certainly talk to your doctor and have him or her write a prescription to go there and have Keith help you. Or if you're having problems and you wind up, you've been in the hospital and you really need to have some very serious work. For instance, people with strokes, they don't keep you in a hospital. Most of the time they send you to a rehab center.
Correct.
And you may be to some rehab center, but maybe not to Regents Park, a Boca Raton rehab center. And I know how wonderful they are there, how much they do for people. So you're free to transfer. I'll just say that to you right now on the radio. Yep. They may not even have a speech pathologist, a speech therapist. And if they do, may not be someone that you're really getting any benefit from. You may want to transfer just because of that. It's all up to you. You know, nobody can make you do anything. And so think about that. It's a new day here.
Right.
Keith, in your working with human beings, and this is a little chauvinistic, but do you get more out of the women or the men?
You know what? I get a lot more, I think, out of the women. Maybe because I'm a young man, but that seems to help, you know. But then, you know, I can pal around with the guys too, you know. I have a pretty good knowledge of history, so you know, a lot of my guys are veterans, so I talk to them about their time served, and you know, and really that helps get the language out too, because that's something that's, you know, near and dear to their hearts. So, you know, I try to keep up with that kind of thing, and it really helps with the rapport, we'll say.
Are there more than just you as a speech pathologist at Regents Park? Is there just one?
My director of rehab, my program director, Raquel McHugh, you've had her on. She's also a speech pathologist.
Oh, that's true. I have.
Yep. And I'm the main guy. I'm the lead therapist here. And I call in per diem help when needed. And that's usually once or twice a week. I'll have a part-time or a per diem therapist come in and help as needed. Yeah. But I'm the main guy.
Okay, well, talking about military, my husband, I just talk about him all the time. He was in the Air Force and flew B-17 bombers, and he flew 35 missions, so you'll enjoy him.
Yes, he's got some stories to tell.
He does. Right, well, he wrote a book also called Air Force Cowboy, and it's been pretty popular with people who are in the military. But you see, by the way, I find that a lot of men who've been in the military are highly disciplined, and I would think that those patients that you get will do what you tell them.
They do. They usually don't give me a hard time.
Right.
But like you said, they have that discipline in their background. So, you know, I kind of treat it that way. And, you know, so you got to do this, 3 times a day. Blah, blah,
right.
blah.
Yes, sir.
They end up doing it.
Yes, sir. Right.
And now I'm your CO now.
Oh, that's just splendid. So when we get, you know, there are a lot of names fancy names, like in your article you call apraxia, dysarthria, aphasia, and of course a lot of these things do come from diseases such as Parkinson's, Huntington's disease, and all, but a lot of people don't have those diseases. They just have other problems.
And this is true, yeah. I mean, usually with those diseases, you'll always have these kinds of problems. But like I said, you know, a lot of folks, you know, go into the hospital with other medical issues, and they come out with either speech, language, voice, or swallowing problems.
Wow.
And, you know, and a lot of them really don't even think about it until, you know, something happens. They don't understand, you know, and I have to do a lot of education, a lot of counseling, especially when, you know, you're not allowed to have water, for instance. You know, people take water for granted, drinking for granted.
Right.
Until something like this happens, and then, oh my God, I can't have a glass of water when I want it, you know, and then that can cause a lot of, you know, grief, depression.
Yeah, and then you would probably let people drink through straws. There's all sorts of things like that too, isn't there?
Different techniques, yeah, for sure. And you know, and also if I have to get, you know, if I have to get a diagnostic test done, we have a great company that comes out and does what we call a modified barium swallow test. That's that's an X-ray test of your swallowing. I can also get that done here. The patient doesn't have to go to the hospital for that because we have a great company that comes out, Swallowing Diagnostics, that comes out, and they come to our facility, and we're able to do the test right there, and I can give them results immediately, which is great too.
That's very important. That's right. More people are, like have gun will travel, or
yeah, exactly.
That's what's happening. My guest is Keith Kolesar, and Keith is a speech-language pathologist. He is there at Regents Park of Boca Raton. And as you were talking about something there, you mentioned people who are that haven't had those diseases, but they have other problems. We started talking about medication and people who are taking maybe over-the-counter drugs, and maybe they're taking too much of it. So you have to be pretty smart about a lot of this stuff.
Oh yeah, I gotta understand drug reactions and how a lot of drugs do affect swallowing. Like I said, a lot of drugs affect voicing because of the drying effects. So yeah, you gotta be on top of your game. You gotta be knowledgeable in pharmacology to a certain extent too.
At least question is, so you think, because there are probably people there that don't have any idea, why this is all happening, and they're looking to you, and their families are looking to you. What's going on with dad or mom? So it's a big subject, and I loved having you on my show. It's a very important subject. And most people don't talk about this. They ignore it because, as you said, it's not like a knee or hip problem.
Right.
It's, oh, well, mom's just not talking the same way, or she's stumbling or stuttering, or and then people with Alzheimer's, we haven't even gone through any of that. I mean, you can imagine
that's
about
like
even forgetting how to swallow, right?
Exactly. They forget how to swallow. They forget how to eat, that kind of thing. We also do cognitive retraining here. So, working on memory and problem solving and, just, things like that. There's also a lot of that, too, that comes along with the early stages of dementia.
Sure. Well, I look forward to meeting you personally, and I am going to figure out how to get my husband over there.
Yeah.
And I thank you so much, Keith, for taking the time today. I know you're a busy guy, but we do appreciate it, and all our listeners appreciate it. So let me give a phone number for people to call. It's 561-483-9282. I'll repeat that, 561-483-9282, or go on the web at regentsparkboca.com. Thanks again, Keith.
Thank you very much.
All right, bye.
My pleasure. Thank you.